Hello everybody, my name is Denise Kelly. I work full-time nights as a frontline nurse and I'm also chair of the National RCN Trade Union Committee. We are in a healthcare emergency. We have got 45,000 nursing vacancies. We have got a recruitment and a retention crisis. I know there has been recruitment from international countries, especially ones that are red listed, and we have opposed that and it's wrong, but we do support and value those people when they come to the UK. We need to be listened to. As I say, we're the most trusted profession. We're predominantly female. When you listen to the voice of nursing, you listen to the voice of your patients and the public. And ultimately, we're all going to be recipients of care from the cradle to the grave. You're always going to end up having intervention with a nurse at some point. So at the minute, what we're trying to do is get the government to recognise that we are a safety critical profession and we're going to be lobbying for safe staffing ratios. At this moment in time, people don't seem to realise that if you want to be a childminder, you can only look after a maximum of 3 children. If you are a registered nurse, there's no limit on the number of patients that you can safely care for. And we know from our research and data that for every additional patient that we care for above 4 or 5 patients, there's a mortality rate by 7%. So it's a massive patient safety risk. So we're lobbying for safe and effective care, we're lobbying for safe staffing legislation, and obviously, as you can see from my top, fair pay for nursing. And safe staffing saves lives, or as the other saying is, staff shortages cost lives. We're all here for our patients. So as a trade union, we have engaged, we have educated, and we have empowered our members to have their voices heard. And that was hard as a predominantly female profession, but now we nearly have given them permission to have their voices heard. All our action has been safe, it's been effective, it's been professional in terms of derogations, and I think it's sent a massive message out there to the trade union movement. When you engage and empower, get that collectivism and that solidarity at the grassroots level, we can be a powerful force to be reckoned with and we can deliver. And as the largest union, nursing union and professional body in the world, we're very happy to reach out and give help and support to any trade unions that are out there, as I talked about in my speech today. What I have found from attending the EPSU conference today, we all have the same stories, we all have the same challenges. We're talking about burnout, mental health impact, trying to recruit, trying to retain, and retention is the biggest problem. We're hemorrhaging our nursing staff. People can't cope with the job anymore. They feel undervalued, underpaid, and underappreciated for what they do. So now's the time we need to build that movement, we need to build that foundation. We need to fight for fair pay, terms, and conditions to enable us to recruit, to retain people, and to try and put it out there, again, not just in the UK, but to our European and worldwide, internationally, that nursing isn't just a vocation, it's a safety critical profession, and we should be proud to be a member of that. So at the Royal College of Nursing, as well as being a trade union, it's also a professional body, and we have just launched our Royal College of Nursing Institute of Excellence. The Institute's going to have an Academy of Activism, and an Academy of Professional Practice, an Academy of Research, an Academy for Workforce Planning, and finally an International Academy. And they will be central hubs where we'll get data, we'll get expertise, and we'll be able to reach out and share that learned practice with our colleagues and our comrades in other countries as well. Because at the end of the day, we are a profession and it's about enabling and empowering other people. And we want to give something back to our nursing staff that work right across Europe and the world.